province-wide immunization program. There's been both a report from the Auditor General as well as a review carried out by the Ministry of Health and Long-Term Care, both of which made a number of useful recommendations for improving the program. And we may even get a little bit of relief in workload because of an approval of a shift in the dose schedule for human papillomavirus vaccine, which is one of the vaccines that we deliver in schools, from a 3-dose to a 2-dose schedule.
Dr. McEwen, I don't have your deck in front of me, but how are you doing in terms of getting through it? Because I was just going to think of applying the same stricture to you that I did to your predecessor at the TDC and put the clock up and say that we could work through whatever you thought was most important in your presentation.
I will happily work within a 1-minute time frame.
Well, no, 1 minute. Oh my God, I was going to offer
Almost
more.
done.
I was going to offer more, but I'll give you 2.
All right. We're going to continue to advocate for funding, and the province has said that they will provide some transitional funding to local boards of health to assist with the changes that are happening in the program. We're planning to phase in the implementation of the new day nursery immunization program, pending funding from both levels of government. We have been holding clinics in high schools that are catch-up for students who don't meet the requirements for the 3 new vaccines, and that'll help keep more kids in school. And we're working on enhanced vaccine information and promotion so that we can reach more parents with good information about the benefits of vaccination. And finally, I want to talk a little bit about tobacco enforcement. I mentioned some of the challenges in this program as a result of enhancements in legislation at both the provincial and local level. That's good news in the sense that we've got more tools to reduce the significant harm that results from tobacco use. But there's an enforcement workload of 2 kinds, partly a transitional one. Whenever you bring in new regulations, people have to get used to them. We do a lot of education. We do more targeted enforcement. But there will be an ongoing increase in regular enforcement over time. There is some funding available from the Ministry of Health and Long-Term Care that we're trying to secure to assist with their support with this new level of enforcement. And we have recently been planning to implement handheld field technology, so our staff who are out in the field will have access to our information systems which govern these programs, and means they have to do less going back and forth to the office in order to complete paperwork. So that's a very concise version, Mr. Chair. I'd be happy to answer questions on any of our programs and services, but I thought that's what would fit within the time allowed.
I appreciate that, and I realize it was a summary, as it is for the other organizations, and I thank you and your colleague very much. Could I just start by asking you this question? You know, I know from serving on a hospital board that one of the most frequently used words now is outcomes in dealing with kind of what we're trying to achieve through the entire healthcare system, including public health. And I'm interested in the fact that, you know, a lot of this information I think is both relevant and encouraging in the context of the activities you're undertaking, inspections and investments and various things. But there isn't much mention of outcomes, and I realize sometimes they're hard to measure. But, for example, do we have any evidence that the increasing investment over time, and I